This is the iMoveU podcast, getting you private practice ready. We give you fresh ideas on mindset, communication, and clinical skills so you can have a fulfilled career.
Welcome to another episode of the iMoveU podcast. What a time to be alive. Today, we have a special guest, the one and only Daniel Monteleone, who is a podiatrist from Proactive Health and Movement in Victoria. Welcome, Daniel.
What a time to be alive. I've been waiting to say that for a while, AZ.
It's such a good line, isn't it?
So good.
I'm really excited to have you on today, mate. There is such a great story in hindsight, such a great story that I can't wait to share with our listeners. But before we get into that, tell us a bit more about yourself, what you do at Proactive Health, and maybe why you got into podiatry in the first place.
Yeah, sure. So my name's Daniel and I'm a podiatrist and a business owner. Our business is called Proactive Health and Movement, and we called our business name that because we wanted to be a proactive, not a reactive business, and wanted to really have a positive impact on healthcare and people that really want to change things in their lives around health. Our business offers multiple services. We are a multidisciplinary clinic. We offer physio, podiatry, psychology, massage, and dietetics. So more than anything else, I think, as I said, our business wants to be focused around being proactive, and we've got a big shift towards education and communication for our clients. It's something that's at the forefront of everything that we do.
Beautiful, man. And I love that. I love that it literally is in your name to be proactive about health and movement. Tell us, before that all came along, what got you into podiatry?
Oh, that's a really good question, AZ. I became a podiatrist because I dropped out of high school when I was 15. I spent an entire year out of school, and I quickly learned that doing lots of different jobs that I thought were going to be the next awesome job weren't really that great. And I decided that I actually really liked school. So I kind of needed that as a bit of a lesson. And I went back and developed a really keen interest around science and the human body. And having that time out of school made it really difficult for me to just kind of choose one thing to go into uni with or outside of school with. So it gave me a bit of perspective. And when it came to doing work experience, I took it upon myself to just ask if I could sit in with some practitioners or business owners in their clinics throughout all different health disciplines. And when it got to the other side of that, I thought that podiatry was a pretty good career choice, and did a bit of research and it looked right. So I thought I'll try that and never look back.
Cool. Very cool. I didn't know that about you, dropping out of high school. Kept that one a secret.
Yeah. That's one of those little secrets. Yeah.
Every iMoveU listener can listen to. You went in and shadowed at a health clinic or health clinics?
I did shadowing in optometry clinics, osteopathy clinics, podiatry clinics, physio clinics. I did all sorts of things. I just wanted to make sure I was making the best choice with the knowledge I had available. And I thought it was a bit weird that we chose one thing to do for work experience and then maybe choose a career out of that. I just learned from that time outside of school, and I wanted to gain as much actual practical experience as possible.
I think that's amazing. I think that obviously would have given you such a broad sense of what is actually out there. All of them were still related to health, though. So you had an inkling that health was something you wanted to do.
Well, I had lots of opportunity in that year when I wasn't at school to do lots of things outside of health, and I didn't like a lot of those jobs. So I gained an interest in biology in particular, and just the human body, and just wanted to get into it from there.
Yeah, awesome. And then, so you became a podiatrist, you were working, and you actually became a podiatry patient yourself.
Yeah, so when I was, been working for about 5 years, and I was around 27 years of age, I did a Liz Frank injury in my foot and broke 8 bones, not requiring surgery. But yeah, that was a good lesson.
Mm. Liz Frank injuries, for the non-podiatrists out there, they're not a very nice injury. For the AFL followers out there, it's what pretty much ended Dane Swan. Do you want to tell us more about the Liz Frank injury? What's a normal pathway for recovery?
Well, I think it depends on the severity of the injury, but sometimes people will undergo surgery.
Yep.
I had a surgeon that I trusted and consulted with at the time, and he gave me the confidence that surgery wasn't required, and that just booting it up and waiting it out was going to be the right way of doing it. And so we thought we'd give that a go. And I wasn't really thinking much more beyond that. I thought boot goes on, it comes off. We'll eventually get to a recovery date. But I did come out of that boot, and I walked around for a matter of hours and refractured my cuboid. And the advice at that time was to go back into the boot and wait it out again.
Yeah.
And I did. It was a long wait, but eventually got out and tried to return to the same level of activity rather quickly. There was a lesson in that one.
So even though you were a podiatrist, like you said, being a podiatrist for 5 years, you're still the typical patient, right? Jump back into things as quickly as possible. I don't blame you. I did the same thing when I injured my hamstring. I guess this is where it gets interesting, right? Let's say at the start, we've got a great story to share. And if you don't mind, Daniel, maybe you can share what that first 6 months of your injury actually was, and how you felt during that time, and just what happened.
Yeah, so coming out of the boot and trying to get going again the second time, I'd probably made a few decisions and made a few thought processes quite strong in my mind. So I decided that I didn't want to be stopped anymore. I decided that pain was something that I wasn't really going to focus on. I was going to put up with. That were pretty terrible lessons to kind of draw. But I think looking back, I was pretty frustrated at the time and just wanted to get back to doing the things that made me feel good. So that was the plan. And I tried to get back to a high level of physical activity, ignoring some of the hip pain that I was experiencing. And after a while, the hip pain got too strong and I need to go and have that investigated, and learnt a few things there. So I had a mildly undiagnosed form of hip dysplasia explained to me that was, not picked up my whole life before that. I'd injured the labrum, I'd damaged lig teres, and some of the cartilage had come away from the acetabulum, so what they call a delamination. And it was pretty confronting to hear that. I think that, I went from kind of hobbling around to realizing rather quickly after a couple of physio sessions that things just weren't really getting better, and got to the point where I was very fearful and not really wanting to move around. And I was advised to have surgery, which meant that I had to wait around for 6 weeks, which looked like someone literally lying around waiting in a bed for surgery, which was very, very depressing.
Had you, before that, like before the Liz Frank injury, had you had any hip complaints, hip soreness, hip problems?
No, I hadn't.
No.
I hadn't. Not really. No, like nothing that was anything that comes to mind. I might have had a little niggle here and there, but I had many soft tissue injuries before that, but none that come to mind in my hip.
So you then got told, you rattled it off for us beautifully, but you got told all the structural problems, so-called problems in your hip. Do you recall how you felt about that at the time? Or like, were you still very much like, okay, well, this is what I need to go and do and I will deal with it? Or what were you feeling?
The way it was presented to me, including a big conversation around a cam lesion, I felt like I didn't have a choice at the time. It was presented in a way where it was like, this is what's going on, this is the recommendation. And as I didn't know a whole lot about it, I trusted that process, and I just wanted to get back to having some kind of a normal life. It was pretty different at that point in time. Yeah.
Yeah. Maybe, continue on. Tell us what happened from there.
So I underwent surgery. I was told that I could expect to be walking and back at work within 2 weeks. That process didn't quite go to plan. 5 months later, I was still getting around with 2 crutches and unable to put my full weight into my leg. It was really tough. I'd gone through many different practitioners that I felt were not the right one, and that I'd go on looking for another that hopefully would be the difference. And that 5-month period was really tough.
You talked about going through a few different practitioners. If you can recall, was it was it looking for a specific treatment? Was it looking for a magic answer, or was it really like I didn't connect with a therapist and so I moved on? What do you recall at the time? What you were feeling?
It was probably a combination of all of those things. Some of the practitioners I worked with let me know that they should probably stop working with me at that point in time as well. I recall once someone saying to me that the protocol that they had laid out worked for X amount of participants, and that was quite high. And they said for another amount of participants, this doesn't work for. And they said, well, clearly this doesn't work for you, so you must be in that group. And I said, maybe you should find someone else to try and help you here with this one. And I did. So that was one reason I moved on from that practitioner. Yep. But yeah, all in all, I think that people probably lost confidence working with me because we weren't getting a positive outcome in the time frames that we were expecting to get those positive outcomes. And as the process went on, I was becoming increasingly more frustrated and increasingly more desperate, I guess you could say, towards the end of it. I became far more active in my role as the client. I remember going into the last few practitioners with a list of the things that I wanted to achieve. I was very determined, and very, very fortunate to eventually have someone respond in a positive way to all that energy and all that drive. I guess that match is what I needed in the end.
And it's going to be really exciting to then talk about what happened when we did find, someone that could help you and what we think was the difference there. But before we move on to that, if it's okay, can you talk a little bit about, in hindsight now, what you think may have contributed to you, maybe that delay of progress, maybe, your thoughts and feelings during that 5 or 6 month recovery? Because I know it wasn't the best time of your life. Anything you're willing to share there?
Yeah, look, I think, for me to talk about this even now, it's something I'm extremely passionate about, and I'd love for people to learn about and take lessons from. And it's also still quite challenging to talk about from an emotional point of view. It still is something that is something my body in a way also has not forgotten. So there were some things from a communication style or a soft skills style that really kind of hit hard and were a little bit of the final straw in many scenarios that I decided that was enough. I needed, this person was no longer right for me. And it's just so interesting, I think, how words can stay with you. So I think that almost anyone that I've spoken to where they've had a poor health outcome, or haven't really had a great healthcare experience, people will often talk about what the practitioner said. And for me, there was some words that really kind of got to me. So, I think choosing words carefully is something that I really promote in our clinic with our practitioners. And sometimes your words can really have an effect on the entire outcome. So, a few things that I will share is that, one example I was seeing, I think this even might be the same physio I was talking about earlier. So, this practitioner said to me, I think I'd filled in my initial consultation form, and I had a lot of complaints about my back at that time. I was having some other pathology kicking in other areas of my body, but I was very focused on my back, and the practitioner picked up the form and looked at it, and then looked at me and said, I've looked at your scans, and I understand your surgical history here, and I know you're really worried about your back, but look, don't worry about your back today. We're going to focus on your hip, because you've had a hip operation, and you're a hip. And I remember when he told me I was a hip, I'm like, well, I'm not a hip, I'm a person. But that was very frustrating, because I felt like I left that consultation just not getting what I was looking for. Like, what I was really looking for at the time was relief of back pain. That was the big thing for me that day, and it was heard, but it was not acknowledged in a way that it was such a big thing for me. And I left just not having my need addressed. So that was a big one. I won't forget those words. And just little things, like flippant things that I think sometimes people also don't notice. The reason that the iMoveU content resonates so much with me is just the attention to communication and how that can have an impact on people. And I think one of the biggest letdowns I also experienced throughout my recovery was I was with a practitioner who just simply, walked me out of the room at the end of the consultation. And I thought to myself, well, I guess this is the end of the consultation. And I followed them to the front desk, and they turned to the receptionist and they said, I'll see Daniel on Friday afternoon in 2 weeks. And then they said goodbye and they walked off. And I remember thinking, well, I don't know if I can wait 2 weeks. Is this all I've got to go with in that 2 weeks? And it was a really long and hard 2 weeks. I didn't reach out to the clinic. I could have done a bit more from my own perspective, but I didn't do that. And over that 2 weeks, I struggled a fair bit, and I was counting the days back to that consultation. So, in the hindsight that I've now got, I think that it's such an important thing to have that conversation with the patient about, how quickly would you like to respond? Or if you had an opportunity to make an impact fast, would you like to take that opportunity to do everything in your power? If someone had said that to me, I would have said yes, and I also remember realizing that at one point, I didn't care how much it cost. I'd spent 10 years building a hot rod with my dad that I really loved that car. I sold that car so I could, look after myself while I wasn't working, and also use that money to focus on my recovery. So I think when you're struggling that much, finance, for at least myself, I couldn't have cared less how much it cost. I would have much preferred to see that practitioner more often.
It's so hard. It's such a common thing in allied health where, like, we don't know what that practitioner was thinking. They may have just looked and gone, in 1 week's time, I'm fully booked, and booked you in 2 weeks' time, right? Well, like, we don't know. It may have been thinking of finances. It may have just been thinking, I don't think much will change in a couple of weeks. But by the sounds of it, you guys didn't really discuss that. Was there a plan in place, or was it very much just got to the front and then found out, I'll come back in 2 weeks?
I was always a session to session plan. So I'd find out what to do, and then we'd look to the next session for another list of things to do between now and the next session. So there was no roadmap, if you like, to have a bit of a thought process as, by 4 weeks from this point, I can expect to be here. It wasn't that. And I think that also creates a lot of uncertainty for people.
Massively. Part of that sounds like, it wasn't even a conversation to begin with where you could, ask a question or even say, hey, 2 weeks seems a bit long. Like, let's talk about that. And I think almost on top of that, the fact that you said you didn't reach out to the clinic in that 2 weeks. So, it probably didn't seem like you were that open to go and talk to them, because it probably didn't feel like that were being that open back to you with the plan.
No, I was probably concerned that I'd be a pain in the bum. I'd be bothering that person. And I wasn't also probably so confident that I'd be getting what I was looking for. So I just did my best. I just did my best in that time. But yeah, I'd definitely do things differently now if I had the chance to do it again. Even
that, though, I think is a really important message for practitioners out there. I often do talk with young therapists, and sometimes if I look at it and go, I wonder if we could have seen that person sooner than 4 weeks' time. Like, I think we could have actually checked up on this or had a look at this further before we send them away. A lot of the times the responses are, well, yeah, look, they've got my email, they can reach out. I've told them to ask me questions. But on the flip side, I think deep down we know human nature is they're not going to, right? Like, as you said, I don't want to be a pain in the bum. And I think we should acknowledge that and go, we can't just let it go, leave it up to them. Like, it's almost, we're putting a burden on them to go, you decide if you want to ask a question, rather than like, let's sit down and quickly discuss, like, hey, we could look at this in a week's time, and this is why, this is the value I think it would bring to your journey or your pathway. And they have the chance to say no, right? But we don't. We just kind of go, oh, well, if they think of that on their own, they can get in touch. Doesn't really make as much sense again that way.
Words are still really important. So, even just saying if you need me, even that in itself, those if and needs, that, you change those words, maybe you get a different outcome. But for any practitioner listening right now, if you've never ever been on the front foot, if you've never ever reached out to a client when they've got an appointment in 4 days' time, and you could send them an email to see how they're going, or you could send them an SMS through your practice management software to see how they're going, and say, hey, I just wanted to know how you're going. Are you going all right with this? Tell me about it. If you've got a win, share it with me. If you're having a bit of trouble, let me know, because I'd love to help you over the phone or via email before the next appointment. Yeah. If you've never tried that before, try it. You'll be really surprised. I'm always really fascinated, how an email thread can go when you're looking at that and you've made that reach out, and then you're looking back through 12 or 15 emails, and you're building that rapport, and that person is building trust with you, and they've been for a run and now they've got a little bit of toe pain and they're concerned about it, and you're able to give them that reassurance and tell them it's okay, and not necessarily rush them back to the clinic, not necessarily give them any reason to worry about it, but simply reassure them and empower them, while also building your own brand, while also building your relationship with that client. If anyone has a problem that client knows in the future, they're going to be recommending you because they trust you, and they're probably going to have a very, very good health outcome because they trust you.
We talk so much about therapist alliance, rapport building, trust. That one tip, Daniel, that you mentioned, to just contact your client. Don't wait, they're in later this week, I'll just see them when they come in, is such a game changer. I know my wife, Melissa, who's also a podiatrist, she was the person that was at the forefront of this in our clinic, to the point where we decided as a team, this should be our standard. Like, why does Mel always get these raving fans that call up and just want to see her and thinks she's the best person ever? It's because Mel would contact every single new appointment, so every initial client, within the next 48 hours. And, the worst conversation you would have is, yeah, it's all going great. Like, oh, I can't believe you called me. Like, thank you so much. That'd be the worst case. So the best case, when they actually had questions, when they actually did want to talk something through, was amazing. It would, I think therapists sometimes get scared, oh, I'm going to be on the phone for an hour with this patient. No, you'll be on the phone for 3 minutes, and that 3 minutes can mean such a big difference in the world of that patient.
Yeah, absolutely. Absolutely. And, that's been a real change in my mind. I think as a practitioner in the past, I wouldn't have wanted to do this. As a client, I would have been, as I said, I was scared to reach out. But if you can lean into it and at least experiment, I think it's easy to judge when you never tried. But if you can experiment with it, if it's like all the cases I've seen before, you'd be really surprised how amazing that can be to build rapport. Any little things that your client might be experiencing that might be a little problem that you otherwise would never have known about, you get an opportunity to help that person through it.
Definitely. And I think there is that sense that if I contact them, am I trying to book them in the diary? If their appointment's not for 2 weeks, and sometimes it's not even if I am thinking that, but am I thinking they're thinking that? Just go around in circles as a practitioner sometimes. But it's just about care and adding value. Like, if you can answer a question a week or two before their appointment, how good is that, rather than them waiting for 2 weeks?
Yeah, and it comes down to intent, I reckon. So I've had a few people say that to me in the past, like, here's my reservation. Yep. And I'll say, well, if ultimately that's your goal, to try and book that person in again before your next appointment, or you're trying to look for an appointment, that person on the phone, they're going to feel that that's your intent. It doesn't matter what language you use, they're going to feel that intent, because that's where you're trying to direct the conversation. But if you're calling up purely to try and support that person, offer them a chance to ask a question, just to check on them and make sure that they've had a good outcome, and that is it, then that person's going to leave that conversation going, you know what, that person just called me to make sure that I was getting a good outcome. And if for whatever reason they're thinking anything else, well, like, you can't help that. But focus on intent and hang your hat on that, and I think you can be happy with that.
I love that. In terms of really focusing on intent, we used to have follow-up calls or cancel calls, and it wasn't to rebook people, but because they were called follow-up calls or cancel calls, that was almost that underlying, oh yeah, I called this patient, but I didn't book them in. And I remember, speaking with multiple practitioners going, that's okay. Like, we don't need to be booking them in. And I used to try to word it like, oh, it's a follow-up call. We're just following up to see if they're still going okay, if we can answer any questions. And it wasn't until we actually changed the title of this altogether. We now call them point of care calls. So we're calling, and can we give another point of care? Whether that's a progression, whether that's just answering a question. And like, that's all we're after. And I think there's been a big shift in our clinic, which just reinforces that language matters, right? Even for us as practitioners. Yeah. But it's funny how negative it can be just because we called it a follow-up or a cancel call, because if someone had cancelled, we're calling them. But therefore, it must be about their cancel. It must be about booking them back in. So I wonder, even, can we improve our own systems in clinics by just changing the language to change intent, which I really liked, the distinction you put there.
100%.
I want to go back a little bit, if that's okay, because I think this is a really important message as well. But you said sometimes just off the cuff remarks or things that can kind of be said, and we may not think it's a big deal, and it might be a bit of a slip of the tongue. We didn't even intend it the way we said it, but can really stay with a person.
Yep.
I know there's a couple of other examples that you have, and throw you under the bus if you're happy to share a couple of them, because I think it's important. I think it'd be interesting to talk about them and go, what was really the intent of that comment versus what impact did it actually have? Yeah,
no, that's really good, right? So it's really good that you even draw me to that, AZ, because I know that you've seen these. So I've got a list here, and reading them out, even that challenge there by you about intent, it may not, and it did not, I can tell you, these things did not come across that way. So probably one of the more flippant remarks, I was getting a test a little while after my surgery, and the person said to me, geez, your muscles and tendons are so tight, I could play your leg like a guitar. And maybe they were trying to be funny, but I really didn't appreciate that. And I still haven't forgotten that.
Yeah.
What else have we got? Probably one of the biggest ones when I did come out after surgery. And, I look back on my experience, and after all this time, I know how much of an effect this had, but I was explained to after my surgery that it was meant to go for quite a short time. But my hip was so bad when they got in there, and they spent so much time in my hip that the entire surgery list was running late for that day. And that information was shared with me at the time, which made me feel like a problem. It made me feel like, goodness knows what my outcome was going to be. It probably wasn't going to be good, just from those words. And I wonder if those words were different, what might have actually happened.
I think that one's a really powerful one, because if I try and put myself in someone else's shoes, I think we've briefly talked about this before. Like, they may have just been stressed because, they are a bit behind schedule. But did they have to, probably frame it as it was so bad, it took us so much time. It was so much time that now we're behind for the day. It just gives it a whole other meaning, doesn't it?
Yeah, and I've done a bit of thought and work on this stuff, and I probably have come to the conclusion that person was under a bit of pressure and feeling quite stressed, and so that's where that level of understanding and forgiveness comes in from my point of view. But I believe it did really, change the course, or at least have an effect on the course of my recovery. And the big lesson in that for me is just the learning experience. That's the silver lining, and that's why I care so much about words and helping people with chronic pain.
Beautiful, which ties in nicely to moving on, and let's talk about how things turned around. So we've talked at length now of some of the experiences you've had, some of the language being used. Yeah, we have hopefully a happy ending coming up. Tell us more about what turned it around.
Yeah, it's definitely a happy ending, and I'm really, really pleased to say that. I did eventually go on to another clinic, and it was just so different. It was so different. It's something that I knew, like, from the moment I got there. I walked in and it was just clean and spacious, and the person behind the desk spoke to me kindly, and there were like nice magazines and it was just so different. And I remember sitting there, and it wasn't an overly busy clinic. There wasn't people racing around, and you didn't see people in a hurry and people stressed and phones ringing and that sort of thing. And eventually, my practitioner called me out and just really kindly introduced himself and shook my hand and looked me in the eye, and just with a lot of care, just sort of gently helped me to the room. And we sat down, and I don't think I'd ever been asked that many questions. I just got grilled in a really caring way. And I just remember thinking, like, wow, this is so different. And the assessment was so different. It was not focusing on one thing. It was a really zoomed out approach, and where I was also acknowledged as a practitioner myself. I was acknowledged for, a person said, well, it's clearly you're going to have your own thoughts and feelings about this. You're a professional. Tell me what you think. And we had a slightly higher level conversation where I was sort of brought up a level on the scale, if you like. And it was just unreal. I remember thinking to myself, this is pretty incredible, and I've learnt more today than I have learnt in months, and many different people. From this one person, I've just learned so much, and that learning and that knowledge gave me comfort. It gave me reassurance. And, you know, towards the end of that assessment, you know, the practitioner said, look, there's not a whole heap I can do here for you today in terms of changing things today. But what I can do is give you an expectation of how we're going to get this right. And they just rolled it out. And I sat there and I nodded my head, and I could see it as they were talking about the steps of the recovery. I could see in my mind that change. Like I was there, and you know, I really had that confidence to move on. So I couldn't wait to get back to the next appointment. I couldn't wait to get home and share the news with people. And yeah, it was pretty full on. It was pretty special, and it had such a profound impact on me. You know, I was walking again without my, you know, any aids within 4 weeks, and I was running again within 12 weeks. You know, albeit a bit rusty, but I was running again in 12 weeks, yeah. And I at that point, when a lot of the fear started to sort of drop and the confidence started to kick in, I looked at, you know, eventually that practitioner left, and I was a bit apprehensive about that. But by that stage, I'd realised that was the environment there, and it didn't matter. I got handed over very well to another practitioner, and I developed a very good relationship with them. And I remember looking at him one day, and I said, you know, like, this has been so different to anything I knew. You know, I did not learn this at uni. Mm. And, you know, like, what have you done? Like, where can I go to learn this stuff? And, you know, it's made such an impact on me. You know, I don't feel like I kind of go back to my career and sort of plod along the way I was. Like, I want to make a difference as well. And yeah, he looked at me and he kind of said, you know, Daniel, uni is like, that's your entry ticket. Like, it's, you want to learn from there. I recommend you do this particular course and this particular course, and you read this book, and, you know, you become, if this is what you want, you know, you've got to dive in and commit and make a decision that, you know, this is how you're going to do it. And, you know, that's something I won't forget. You know, I took that advice, and yeah, I just ran with it. It pretty much grew from there. So I got to a point where I could take care of myself. I was, you know, confident and empowered. And throughout that experience, it was a massive driver for me to, you know, want to make a difference outside of that. But I could also use my own personal journey as a way to connect with clients and share what I'd been through, and use that as a bit of a way to display empathy and build rapport. And, you know, that's something that still is powerful, and I'm still sought out as a practitioner because people have known that I've been through it. Yeah. And that's really what our business, you know, Proactive Health and Movement, is about.
It's amazing, mate. Thank you so much for sharing your story, both the start, the first 6 months, and how tough that was, and then obviously a much better ending. And I'm sure everyone's picked up on it already, but all the types of things you mentioned there had not much to do with your condition or even the pain itself, in terms of, like, is this painful? Even the fact that you mentioned magazines and the fact that people just spoke to you kindly. I'm sure there's people listening that would be like, well, yeah, of course, we all do this. But it's not really the case, is it? Like, I'm sure the past practitioners weren't horrible to you, right?
They were not horrible to me, and I believe that they were all trying. Yeah. They were all trying, and I think there also was a point where they lost confidence that they could help.
Yeah.
And you know, in their way, when they were probably trying to recommend me moving on, or at least in some of those cases, they were still trying to help.
Yeah.
But, you know, perception is pretty powerful, and it can have a, you know, an impact on the nervous system and our biochemistry as well. So understanding those things, and deliberately wanting to go deep in that way, you know, how could we possibly be as bold as to choose our words to deliberately alter someone's biochemistry and their nervous system. Like, if we can use that, why wouldn't we use it for a positive outcome?
Yeah, definitely, 100%. So, loaded question. How important do you think the skills were of your therapist? The ones that did help?
You know what?
Hands-on skills. Sorry, I should be more specific.
Oh, hands-on skills. Look, I appreciated the hands-on work that I got.
Mm.
It was, over a 60-minute consultation, I was lucky to get 5 minutes worth of hands-on work.
Yep.
The rest of it was learning and exploring movement and pain.
Yep.
Practical things. Physically, learning those things physically, but drawing lessons on them cognitively.
Mm.
So I was not sat down and explained, how the body works or how pain works for God knows how many minutes. I was moving, and that experience of actually moving is what brought me the lesson that I could, the lesson that it is possible. And that's what got me going. If I had not have been doing that, I don't know. I think that was the biggest lesson for me, and it's how I practice. I get people moving, and I want them to draw lessons on those movements. The lesson out of today, the thought process, or the thing that I've learned out of today is this, and I've learned this through a physical movement combined with words that have meant something to me.
That's amazing, Daniel. The distinction there of not being sat down and just talked at, let's call it, educated at, makes me think of a good friend of ours, Dave Renfrew, and he talks a lot around like pain science isn't for the patient. It's for us as practitioners to understand. How do you feel about that?
Well, it's funny you mention his name, right? Because Dave was someone that influenced me throughout my recovery, because I was on his Insta having a look at some of the messages that he was throwing out there, and it was something that was a bit of a like a shining light for me, really. Like, it gave me the confidence, and even just those messages, a little bit of the internal dialogue. So those words written down on a screen on a phone got into my psyche and helped spur me on. And so powerful. And I love Dave's work, and I love the way he explains things so that we can understand them better. And I support that statement that pain science is mostly for the practitioner. We might be able to share a little here and there so they can put it together a little bit and understand it a little bit, but talking about some pretty high level stuff with people that might not have the foundational education, it's just not fair. And I'd love to hook a heart rate monitor on. This could be an experiment, right? So I'd love to hook a heart rate monitor onto a client who's experiencing chronic pain, and we'll sit them down, we'll give them a bit of pain science at depth, and we'll see what that does to their heart rate. There's definitely positives that can be shared, but we have to be so careful to consider the person that's listening and consider the person that's hearing that message, because at the end of the day, it's about them, and it's about what matters to them, their pain, their activities, the things that mean a difference to them. And I think we've got to be so careful not to cross that line and make it about us.
Had that happened to you, Daniel? Had you had pain science, thrown at you essentially, or was there just no real interaction around that kind of stuff?
I'd had a few attempts at, some explanation of how it works, but nothing in depth.
Yeah.
But lots of conversation around structural things that didn't end up working for me. I think all they did was create fear, and there's probably a good amount of research on that as well. So, Yeah, I think from a pain science perspective, not personally so much, but my stance on it is that we have to talk in a way that our clients are going to resonate with. So we've got to be careful with that one.
Definitely, yeah, I agree completely. And as you said, there's lots of research out there to show, how much fear, how much avoidance, how much extra confusion we can actually deliver to our patients. Unfortunately, because I still, as we talked about before, believe that's not the intent, right? No practitioner sits down going, "I can't wait to confuse the hell out of this person."
No, that would be
it's just
horrible.
not delivered the way we want to. So if we then transition to how this maybe has shaped your practice, maybe even giving us an insight into how much you had delved into the world of persistent pain presentations and chronic pain through uni and that first 5 years compared to now. Obviously you love working with these patients, but I assume, your practice is very different now.
Yeah, so going through uni, being a podiatrist, things were very biomechanically focused, so we didn't get a whole lot of pain science education. Going into my own personal experience and learning through that and developing an interest, there are people out there that, particularly in the podiatry world, that are pretty cluey and interested and can have an impact from a pain science point of view and use that in their clinical practice. I think although we do that in our business, that's really not what we focus on. Our focus comes back to compassion. Our focus comes back to education. Our focus comes to, empowerment of people. And really that's what it's about. And I think those things, if we can teach someone about how it all works and how it works for them in a practical way so that they can just do what they want to do without the struggle, without the pain, then that's kind of what it's about. And people know when they're feeling taken care of, and people know when their practitioner has their best interests at heart and is just really doing everything they can to support that person. And so, from a sort of pain science perspective, it's a tiny part of what we do in our business, but it's just all about promoting independence, promoting empowerment, and doing that via education and using our disciplines in that way.
Yeah, perfect. And obviously you then work with your team on this stuff as well. You mentioned before, it's not just podiatry. You do have physio, you do have psychology. How does that work? How does that work together in your clinic?
Yeah, so it's really interesting, right? So we encourage everyone to not separate things. We don't want to say that's part of the head and you go and see the psychologist for that part. Or that's part of your back, you'll go and see the physio for that part. We really try and work collaboratively, but also encourage each other to not be so scared of exploring the edges of our clinical practice. I think we can be super, super afraid. And if you're doing what you can without crossing the line, with making sure we're staying within the realm of our own scopes, there is so much that we can do for people. We can do so much to help. And I think we are a business that really promotes that exploration within our own field and also that collaboration. And it's beautiful, when you see a client that comes in and has a huge change, often in a pretty short amount of time, and they get to know a few people within the business and they say to you, like, you've helped change so much for me, you've changed my life. That's what it's all about. And I think that I go back right to the start and I think, what would I have needed then? And we've tried to create a space where if I had have walked into our own clinic all those years ago, I would have received what I needed at that time, been well taken care of.
So powerful and so good to hear just the passion in your voice when you talk about talk about that in terms of what you want that clinic to stand for and what you want those patients to experience. I just love it, and I hope it comes through for all the listeners as well. So to throw a curveball, then that's you as a practitioner, Daniel. I think it's a really nice way to wrap things up. What would your advice be for listeners from Daniel Monteleone, the patient?
Yeah, so as the patient and talking to the practitioners, I'm gonna make this clear and simple. So I want from my practitioner someone that listens, someone that values my input, someone that works with me to help me set and achieve my goals, someone who educates and empowers me, and someone who is focused on long-term management rather than short-term management. And finally, as the client talking to my practitioner, I want you to help realize the power within me rather than the power within you. I want you to help me unleash what's inside of me so I can get back to living my life at the fullest.
I love it. Daniel, thank you so much for sharing. This has been definitely one of the most enjoyable podcasts that I've ever done. I know the listeners are going to get so much value out of it. So thank you so much for sharing.
Thanks so much, AZ.
What a time to be alive.
This is the iMoveU podcast, getting you private practice ready. We give you fresh ideas on mindset, communication, and clinical skills so you can have a fulfilled career.